Well, here along Hospital Row in downtown Toronto, a number of healthcare workers either starting or wrapping up their shifts. Now, we know that keeping nurses and healthcare staff here in this province has long been an issue well before the pandemic. And a new study from a nonpartisan research institute is now raising eyebrows after it found that Ontario hospitals spent billions of dollars on for-profit staffing agencies.
Rather than simply funding hospital deficits, the provincial government continues to encourage for-profit involvement that is destabilizing Ontario's health system.
The Canadian Centre for Policy Alternatives found that from 2013-14 to 2022-23, Ontario public hospitals paid for-profit agencies $9.2 billion for services. The report also revealed that public hospital spending on staff increased just 6%, while spending on private agencies increased by 98%. Hospitals can use staffing agencies to get qualified workers for shifts, but they can charge double or even triple regular hourly rates. These numbers are astronomically higher for hospitals outside of the GTHA.
Real per capita agency costs increased by 480% in the Northwest region, by 372% in North Simcoe-Muskoka region, and by 216% in the Northeast region.
The report also highlighted that in 2022-23, while the number of hours worked by agency staff in public hospitals was less than 0.5% of frontline worker hours, 6% of hospital labor costs went toward the private staff.
For-profit driven healthcare must stop and must be reversed.
Health Minister Sylvia Jones was asking about staff retention and private staffing agencies this morning in the legislature.
Why is the government funneling billions into private staffing agencies at the expense of patients and healthcare workers?
We have programs in place that are ensuring, like Learn and Stay, that individuals who want to train and practice in the province of Ontario get to do so.
Now, what about possible solutions? Well, the Canadian Centre for Policy Alternatives has a number of recommendations, one of them being to phase out and ban private staffing agencies over 3 years. Other recommendations include an additional $2 billion annually in government funding to stabilize public hospital finances and increase hospital capacity.
The more reliant public hospitals become on private agencies, the more that they squeeze hospital budgets and hollow out the public sector workforce.
We reached out to the Ontario Hospital Association for a statement. They tell us in part that they are continuing to review the report released today. Afua Baah, City News.